Welcome to the University of South Alabama Bariatric Surgery Seminar. My name is Dr. William Richards, and I am a bariatric surgeon. I've been performing laparoscopic bariatric surgery for more than 20 years. What are you going to learn today? You're going to learn what is obesity and how morbid obesity causes chronic disease and negatively affects your health. I will discuss the two surgical options, laparoscopic sleeve gastrectomy and laparoscopic gastric bypass. Finally, I will outline your next steps to undergo bariatric surgery. What is obesity? Morbid obesity is a disease. It is a disease and can be associated with diabetes, cancer, stroke, heart disease, and decreased lifespan. Morbid obesity is caused by many factors, including diet, environment, brain and gut hormones, and genetic factors. It is lifelong, progressive, and life-threatening disease. Obesity is associated with increased fat in our body. Fat stores energy from calories in the food that we eat. Fat communicates with the body and the brain through hormones. These hormones control hunger and also turn metabolism up by burning more calories than we eat. If we eat too many calories, we store it as excess fat, which causes obesity. The excess fat causes chronic disease. The brain defends our set point weight. Our brains are set up to control how much we weigh, and there is a particular weight known as the set point weight, where our brains want us to stay. Our brain and gut communicate using hormones that control our hunger and metabolism, or how we use the things that we eat and drink for energy. If the set point weight is high, then obesity can develop and lead to more medical problems and chronic disease. The old theory of losing weight was to eat less and exercise more. That was way too simplistic, and now we know that genetics and hormones, along with diet and exercise, all play a role in sustained weight loss. Why do we care about obesity? Because obesity, particularly morbid obesity, causes chronic disease and decreases lifespan by 5 to 15 years. Morbid obesity is associated with poor health and decreased lifespan because morbid obesity increases the risk of vascular disease throughout the body and therefore increases the risk of heart attacks, strokes, and early death. Morbid obesity is also associated with increased risk of some cancers and marked increase in inflammation in your joints, leading to chronic pain. How does weight affect our personal lives? Our weight can often dictate the ability to do the things we want to, such as riding amusement park rides, playing with our children, attending social gatherings, and also how we travel. People see and treat you differently if you are morbidly obese. A body mass index, or BMI, is a measure of obesity based on height and weight. Normal BMI is between 18.5 and 24.9. Obesity is a BMI of 30 to 34.9. Morbid obesity is 40 to 49.9 BMI. Supermorbid obesity is greater than 50. Google BMI and find out what your BMI is. Morbid obesity is a threat to your life and your well-being. While bariatric surgery may improve your physical appearance, it is performed to reverse the negative effects on your health and to improve many of your medical conditions. Only 1/3 of the U.S. population is at a healthy weight. While fast food has made it easier to consume large portions of fatty food and drink high-sugar drinks, it is not the only reason for the increases in obesity. This figure shows the percentile of each state's population who are considered obese with a BMI of greater than 30. In 1990, most of the population of the United States was in light blue colors, or less than 14% of the population was obese. By 1995, 19% of Alabama population was obese, and by 2005, 29% of the population of Alabama was obese. By 2015, obesity rates, particularly in the South, were above 30% of the population. Here we show the increasing percentage of overweight children is increasing over time, not only in the USA, but in many other countries, including England, Germany, Australia, Iceland, Scotland, Chile, and Japan. All these countries had double-digit increases in childhood obesity. Obesity is not just a USA problem. There is a complex interaction of the brain, fat, gastrointestinal tract, and the pancreas on eating, hunger, and metabolic rate. These interactions are carried out by the nerves, peptides, and hormones such as ghrelin. Bariatric surgery affects all these pathways to change your hunger and metabolic rate that enables long-term weight loss. The appetite hormone ghrelin is secreted by the stomach. Bariatric surgery reduces the ghrelin hormone and therefore reduces hunger and food intake. Bariatric surgery fundamentally changes your hunger, satiety, or sense of being full, and increases the speed with which your body burns calories, otherwise known as your metabolic rate. Ghrelin, the appetite hormone, goes down after you eat a meal and goes up to signal that you should eat again. When you diet by eating less calories, more ghrelin is secreted, making you more hungry and therefore eat more. High ghrelin levels causing more hunger while you are losing weight on a diet is one reason why many patients are not successful with long-term weight loss through diets. This figure shows blood levels of ghrelin in patients before dieting in the open circles and 6 months later in the blackened circles after losing weight on a diet. You can see that ghrelin is higher during the diet than before the diet, and the increased ghrelin levels induce hunger and increase food intake. On a diet, your thermostat for eating is turned up, and it is one reason why many patients fail long-term on a diet. This figure shows one reason why bariatric surgery works. Ghrelin levels are very low after surgery, which reduces hunger and allows you to eat much less and to lose weight and keep the weight off long term. Bariatric surgery resets your eating thermostat and allows you to be successful on a diet. Criteria for bariatric surgery include that you must have failed at previous medical weight loss attempts. Those attempts might be Weight Watchers, Jenny Craig, or other commercial diet plans. We will perform a comprehensive history and physical examination to assess your BMI and medical conditions in order to determine if bariatric surgery is right for you. Sometimes we will ask for a psychologist to evaluate you. We work as a multidisciplinary team to evaluate and educate you about bariatric surgery. You must understand what the surgery changes and the risk involved in bariatric surgery. Requirements for insurance approval depend on your particular insurance policy. Most require a BMI greater than 40 or BMI greater than 35 with significant comorbidities. You must have a documented history of medical weight loss attempts. You must have 3 to 5 years of weight history documenting your morbid obesity. You cannot have been pregnant within the past 3 years. We are here to help you. We will verify your benefits to ensure coverage, review your specific plan, and the requirements that you have at your first visit. We will submit your documentation for insurance approval for surgery. We will provide examples of documentation required by insurance. However, it's really important that you are actively involved in moving the process along. At the University of South Alabama, we offer 2 laparoscopic bariatric surgical procedures. Both are safe and effective when performed by our experienced surgeons who have reviewed your particular situation. Bariatric surgery is a tool that enables you to lose weight and improve your medical condition when you follow our medical recommendations and diet plans. Laparoscopic surgery is performed through small incisions using a small scope and camera system. It is much less invasive than open incision surgery and is associated with less blood loss, less pain, reduced hospital stay, reduced complications, and even reduced risk of death compared to open surgery. 80% of the stomach is removed during laparoscopic sleeve gastrectomy. The stomach is the size of the football before surgery and is converted to the size of a banana. This procedure has excellent results, and since it does not reroute the stomach and intestine, it has a low risk of serious malnutrition and of dumping syndrome. The sleeve gastrectomy improves diabetes and has been shown to improve all the other comorbidities of morbid obesity. It is an effective procedure when you follow our medical recommendations. The post-op diet after sleeve gastrectomy is a high-protein, low-sugar, low-fat diet. The diet progresses from full liquids to pureed to soft and then to solid food. You will eat much smaller amounts of food at each meal, but fill up much more quickly, enabling you to lose weight. Laparoscopic gastric bypass is the gold standard bariatric procedure. We make a small gastric pouch and connect the small bowel to the small gastric pouch so the majority of the stomach and upper small bowel is bypassed. The red arrows on the diagram show the food traveling through the esophagus into the small gastric pouch and then into the small intestine. The gastric bypass rapidly improves diabetes and has been shown to improve all the other comorbidities of morbid obesity. Experienced surgeons have a low rate of complications. The post-op diet after gastric bypass is a high-protein, low-sugar, low-fat diet. The diet progresses from full liquids to pureed to soft and then solid food, high in protein and low in sugar and fat. You should avoid high-sugar drinks and foods, as this will cause dumping syndrome. Dumping is associated with nausea, cramps, diarrhea, sweating, fast heartbeat, and even passing out. Some of the more common risks, complications, and disadvantages of bariatric surgery include bleeding, leaks from the staple lines, ulcers, GERD, gastroesophageal reflux disease, strictures at the anastomosis, or surgical sites, dumping syndrome, an unpleasant side effect that may include vomiting, nausea, weakness, sweating, faintness, and diarrhea. Bariatric surgery is generally non-reversible and non-adjustable. You will require lifelong supplementation of diet with daily multivitamins and minerals. Some of the more common risks and complications of abdominal surgery include post-op pain, pneumonia, complications due to anesthesia or medications, deep venous thrombosis or clots in the legs, pulmonary embolism or clots traveling to the lungs, injury to the stomach, esophagus, or surrounding organs including the spleen, infection, hernia, constipation, dehydration, and even death. The pre-op diet is a full liquid, high-protein, low-sugar diet for 5 to 7 days prior to surgery. The goal of the diet is to reduce the size of the liver to create opportunities for a very safe operation. You should modify your lifestyle after surgery. You need to follow the diet and take vitamin supplements. Increased physical activity is also important for your well-being. What should you expect after bariatric surgery? First off, you will have to understand recovery will take time and much patience. You will not be as hungry as before, and you will fill up very quickly with food. You will have to eat much smaller portions and avoid drinking with meals. Your food should be high protein with little to no sugar and little fat. Plan at least 2 weeks to recover after surgery. Alcohol can be absorbed much more quickly, particularly after gastric bypass. How can you maintain or achieve weight loss? Start today by cutting back or completely stopping drinking high sugar drinks and eating fast food. You should reduce portions and slow down while eating to allow your body to feel full. Ask your primary care provider for help to quit smoking. Also start walking or other exercise you can do on a routine, even daily basis. What are strategies for success? Social support, family, friends, and support groups can be essential for good success. You need to set realistic goals. You need to follow all our medical recommendations. You need to ask questions about all of your care. You need to be empowered. And even though you may face difficult times, remain motivated. Making lifestyle changes is a must. You should start today and look forward to making positive changes in your life. Congratulations! You've already taken the first step by attending this seminar. Talk to your insurance company about your benefits and to your primary care provider about starting the physician-directed weight loss program. Gather your weight history and make an appointment to consult with our nurse practitioner. Diabetes has a serious impact on your quality of life and can cause significant damage to all the other organs in your body. Compared to non-surgical methods of weight loss, as well as diabetic medications, most studies show surgery to be far superior in improving diabetes. This means with surgery, you could come off your diabetes medications or no longer have diabetes. A great research to use is the Escape Diabetes webpage located at escapediabetes.org. Here you can calculate your risk of complications from diabetes, including death, with and without bariatric surgery. The results are meant to be specialized to you based on specific information that you enter and can help you make an informed decision about weight loss surgery as it relates to diabetes. I have published results of bariatric surgery on diabetes. In these 2 published studies, more than 70% of diabetics had complete resolution of their diabetes, and diabetes was improved in 94% of the patients. I have published results of bariatric surgery on cardiovascular risk factors. In this published study, there were significant decreases in the cardiovascular risk factors, including high blood pressure, diabetes, and dyslipidemia after bariatric surgery. Decreasing cardiovascular risk factors reduces the risk of heart attack and stroke. The surgical team includes me, Dr. William Richards, with more than 20 years of experience in laparoscopic bariatric surgery, and Dr. Richard Riskey, who did a fellowship specializing in bariatric surgery at Vanderbilt University in Nashville. You can make appointments to see the surgeons or our nurse practitioner at the Maston Professional Building located next to the University of South Alabama University Hospital. We have office hours Monday to Friday, 8 a.m. to 5 p.m. The phone number is area code 251-445-8282. If you need money to help pay for any aspect of surgery, we suggest that you investigate Prosper Financing. Bariatric surgery and long-term weight loss is a lifelong journey. Bariatric surgery is a tool that allows you to lose weight and improve your health. Thank you for listening today. You have made the first step into a lifelong journey to better health. Our staff can answer your questions. We look forward to seeing you in the office. Goodbye.